So I think, first of all, if you think about three broad buckets, perhaps. First of all, we have to accelerate shutting down this current outbreak. The second is we have to prioritize industries that allow us to bounce back. But there's the third piece, which is there's 200 epidemics a year. So how many times can we continue to respond to an outbreak? So how are we prioritizing investments in preventing this from happening again, having a faster emergency response, having better data, having better systems to isolate, quarantine, and control?
Steve?
I think that there's a risk that we assume that our interventions are going to be more effective on the health side than they really will be. So I think there's a need really to be honest with ourselves about what we're able to accomplish. Having said that, I think that prioritizing resources to the health and public health response is going to be very important, and my staff tells me that those resources are running very low. That prioritization is an important element in sustaining the trust of the population in the system that they're living under, and in a lot of ways that has to be a high priority to try to track that and make sure that public trust doesn't erode any further than it already has.
Yeah, Tim.
Very quickly on this point, I think the financial resource may be most limited by the human resource, and I don't think we've moved far enough, fast enough in recognizing the need for a global surge capacity with respect to multi-purpose workers that could be deployed in this setting, that are required, have the competencies and can plug into the system in ways that there's no way existing staff could manage all of the challenges. So I just think that we really need to put some serious thinking about what that surge workforce capacity looks like. What are the set of competencies? Where can they get plugged in and really be additional in a setting like this?
So just to add kind of a focus back on the last question here as well, a number of people have talked about critical nodes or industries that we can't let fail, or that are critical to our survival through this, or an economic survival. Are there things that we haven't talked about that should be surfaced, nodes that we should?
I think, to echo what he said, you look at Marriott International and you think hotels, but they are diversified in many different fields. Many people do not know that we have a whole healthcare team across the world of nurses, doctors, and nurse practitioners. So when he says mobilization and getting other healthcare providers to jump in to help with the situation, you can use private sector companies that are diversified in many different areas to help utilize and, really get into the groundwork of what needs to be done to get this accomplished.
Okay. Last moment for comments.
Well, I think we should acknowledge that since the start of the pandemic, one of our members has succumbed to the disease. And I note that Dr. Chikwe, who was a very upstanding member of this committee, sadly is not with us today because he is fighting the disease.
Thank you. Yes. So is there any priority that's on this list before we close? Any priority that we have not talked about that you think should be amongst those that should be receiving global priority for donors financing?
Stabilize the foreign government. I want to add one more comment. Like Sophia said, government is falling. We cannot afford a falling government. We got to make sure we need a strong government here. This is with the point we should address.
And I agree with Timothy. We come to a status now where we have to stabilize the resources that we have anyway. If it really falls apart in any sector, we will have resources all around the globe, but how to get them where we want them, how to work them together, how to exchange them, it's beyond borders of companies, of countries, in that status that we are right now.
Okay. Final comment, Tim? Oh, sorry.
Oh, sorry.
Avril?
But something that I mentioned earlier, too, that's not up there, I think, which is basically ensuring that we actually have on the list of things that would receive funding, infrastructure that would allow for both public and private sector help for humanitarian assistance that would then actually help to provide, to address the challenges that are exacerbating the, the spread of the disease under certain circumstances.
Got it.
Real quick,
that's fine.
it may be inherent in the prop-up of industry, but trade associations should be added to that. There's some really effective trade associations today, HIDA being one of them, that is bringing manufacturers and distributors together. Henry Schein's part of it, BD, Johnson & Johnson, 3M, that are very effective in
coordinating?
in collaboration, and we should make sure we're enabling and empowering them.
Okay, Tim,
Very
last comment.
quickly, it's not just about allocation, it's about accountability. If you get money out quickly, you've got to get accounts in quickly. We still don't have that capacity, and without it, you don't have confidence the money's being well spent.
And can I add one? And that is, notwithstanding the fact that everyone is very stretched, one of the things we always need to do is to learn from the circumstances that we're in. So if we don't use this circumstance to collect data, actually do an analytical sort of check, if you like, which for future circumstances we can then rely on in terms of preparedness, we will also be missing something we should be focused on.
Okay. Chris?
Tom, one other area, it's a modest amount of resource in the context, but also one of the things we've been doing since the start of this pandemic is actually increasing some of our focus on the cutting edge science and research and development. This is an unknown pathogen. We live in a period of amazing scientific discovery that may not have been focused on coronavirus. So we're putting some of our philanthropic resources into cutting edge research on getting countermeasures faster, trying to accelerate that 1 year to a vaccine, trying to reduce the cost, because even though the numbers don't currently reflect it, given the pattern, we're going to see lots of cases in some very poor countries. And so getting the cost of commodities down, getting additional manufacturing capability, and trying to harness the cutting edge of science and technology to maybe help end this pandemic.
Thanks. And Steve, true last word.
What we're doing here is really a larger version of what we did in the last move, and I would hope that the systems that were put in place to determine how to share the medical resources would be able to operate at this level as well, that they'd be scalable.
Thank you, Steve. Thank you all for this discussion. We'll bring these recommendations forward, and we will close this meeting and reconvene as needed.